Hi, I'm Dr. Drew Miller, and I'm chair of Sam Houston State University's COVID-19 Working Group. First, let me say thank you for all the hard work you're putting in to helping the university be a safer place to be for our students, faculty, staff, and visitors. Because information changes so rapidly, we're excited to bring to you a regular series of videos focused on COVID-19 on campus to provide you the information you need to help keep the university a safer place to be. Today's video will be focusing on the Student Health Center, and I'm excited to welcome Erica Bumpurs, who is the director of the Health Center.
Thank you, Drew. I'm happy to be here to be able to educate our campus community on what's going on with COVID-19 and the Student Health Center.
Can you talk to me a little bit about how the Student Health Center works to protect students, faculty, and staff from COVID-19, and also a little bit about how you partner with outside agencies?
The Student Health Center is the medical clinic on campus for students, so our role with students as far as COVID-19 is that they can call the Student Health Center and we will complete a telemedicine appointment with them to talk about any symptoms they're having, or if they've had an exposure, to talk about their risk and need for testing. As far as faculty and staff, we are a resource for them if they have questions about COVID, either related to their classroom, students that they're interacting with, or other situations on campus.
So many people want to know about how the case reporting process works for students, faculty, and staff.
I want to start by saying that the reporting process is confidential. So students, faculty, or staff that report through the university portal can know that that information is being kept private. That information is only shared with the Student Health Center Director and also the Emergency Operations Director. What that does is allows us to contact anyone that has self-reported, to interview them and gather more information. This information allows us to follow up with any close contacts or any other areas on campus that might need some additional steps taken due to that case.
So walk us through the testing process at the Health Center. And what are some of the long-term plans for testing as the academic year unfolds?
Currently, students can test at the Student Health Center, or they can access testing at other agencies in town. If they choose to come to the Student Health Center, what we are doing at this time is a PCR test that we send out to a laboratory, and then results are reported back to the Student Health Center. Future plans include rapid antigen testing, which is a point-of-care test that will be done right here in the Student Health Center clinic. The advantage of this is that we can get quicker results to respond as needed. Another exciting addition is a partnership with Huntsville Memorial Hospital. Starting on Tuesdays in September, they'll be on site at the Student Health Center where we will offer outdoor drive-up or walk-up testing. This testing will allow students to have a screening test, or they can also come and test if they feel like they've had an exposure and want to get COVID-19 testing. This testing is supported through Walker County funding, and they have agreed to give our Sam Houston State University students a temporary residency waiver so that they can access this testing in Walker County. I also want to let all the students know that any testing through the Student Health Center or the HMH testing will be free of charge.
So why does the university only report the total number of cases on the Restart 2020 dashboard? Why aren't we including other types of numbers like the positivity rate, for example?
The university protocol is for students, faculty, and staff to report their positive case through the university portal self-reporting site. And so then we take those numbers that are reported and we share them on the university website. While we're sharing the numbers that we have no assurance that all cases have been reported. The challenge of reporting a positivity rate for our campus community is not only would we need to know the positives, we would need to know every test from every student, faculty, and staff member, and then we would need to know the results, both positive and negative, to be able to calculate our campus positivity rate. The reason that we don't provide a positivity rate for just the Student Health Center testing is that it's not representative of our broad campus. The only numbers that we can report are students that test through the Health Center and not the whole community.
Many students wonder if they need a negative test for COVID-19 before they return to the classroom. What is the actual process?
The expectation is that when students either need to be out of class for quarantine or isolation, they first need to notify their professor that they're going to be absent. And then as far as return to class, we're following a medical model. So what that means is if a student goes into quarantine, there's a 14-day period that they would be out of class. And at the end of that 14 days, they are free to return to class as long as they have not had any symptoms during that time. If they did become symptomatic, they would go into our isolation protocol, which is a 10-day period from the date that they started having symptoms, and then they would have to be 24 hours without any symptoms before returning to class. We do not do a retest because science has shown that retesting may not produce valid results and that people that have had COVID-19 can continue to test positive for a period of time even though they are no longer symptomatic. So what we ask students to do is to follow our quarantine or isolation periods. If they've been seen through the Student Health Center, we are monitoring that for them and communicating with them, and we'll let them know when they are free to return. If students have been seen outside of the Student Health Center, then they would follow up with the medical personnel that advise them to quarantine or isolate to ensure that they have met those timelines before returning.
What's the notification process when the Student Health Center becomes aware of a positive case?
When the Student Health Center gets positive results, one of the things that we're able to do is assist the student to register in both the university portal and the Texas Health Trace sites. What this allows us to do is expedite the process of investigating and determining if there are any contacts or other notifications that need to be made. If it's a student who hasn't been seen through the Student Health Center and we are made aware, we can follow up by checking for the student registration in the portal and then reaching out to the student if needed. Once we have that information, the same process is followed along the university protocols for the investigation and contact process.
So what's the protocol if a faculty member becomes aware of a positive case in the classroom?
What we would like to advise faculty to do is to always reach out if they have any questions. And so oftentimes I am having this discussion with a faculty member, and I'm going to ask them a few key questions to determine if there's any need for alarm in the classroom. The first things I start with are, is your classroom set up to maintain the social distancing, and also are you following all of the mask protocols? And if we can confirm that those things are in place, there are very rare circumstances where an exposure is going to happen in the classroom setting. However, if we have determined through investigation that there has been an exposure, then through our contact process, we will notify anybody that is individually impacted by this and advise them of what they need to do.
Thank you, Erica, for taking time out of your schedule to help educate us all about what the Student Health Center is doing to keep the university safer from COVID-19. Please remember, if you have any additional questions throughout the week, throughout the semester, email them to covid19@shsu.edu, and always refer to official university channels for the most recent information.